Good afternoon, dear patients. Today we are going to discuss a case presented in the picture. This is a case of a short frenulum or a frenulum tear. Well, what is the problem here? The fact is that a young man came in complaining that during intercourse, his frenulum somehow tore after intense sexual activity, and since then it has been tearing regularly, which prevents him from having normal sex. The frenulum in this case is painful. Indeed, upon examination, you can see a scarred frenulum. It is short. Naturally, when an erection occurs, the penis increases in size, making the frenulum even shorter, and as a result, it is not long enough and tears. The fact is that scar tissue is, of course, much less elastic than the normal tissue of the frenulum, which creates a vicious cycle and makes these tears occur regularly. So essentially, after tearing the frenulum and developing a scar, a person reduces the volume of the frenulum and decreases its ability to stretch. Accordingly, in this case, it just keeps going in circles, making the problem worse. The frenulum is a connective tissue band that attaches the foreskin to the underside of the glans. It varies in length, and often a short frenulum is inherited. Well, the frenulum contains quite a large number of nerve endings, and this really interferes with normal sexual intercourse. Besides that, naturally, all injuries in this area take a very long time to heal. It's quite a sensitive area, which is something patients don't really like. What needs to be done in such cases? In such cases, a frenuloplasty needs to be performed. You can watch a separate video on our channel for a more detailed explanation of what frenuloplasty is. This patient underwent a frenuloplasty, and as a result, the frenulum was enlarged to a normal size. Sexual intercourse became comfortable, which fully satisfied the patient as the outcome of this procedure. What is frenuloplasty? It is a small transverse incision, just a few millimeters, followed by longitudinal suturing. In other words, this directly results in an increase in the length of the frenulum, which is exactly what this particular patient needs. So if you have a similar problem, it can be resolved with such a minor outpatient procedure.